company is RadiantPath, correct?
Right, RadiantPath Health.
RadiantPath Health. All right, because I want people really to know the name of the company, because one thing, it's incredibly important what you're doing, and besides, it's going to blow up, so people need to know.
God's grace, I hope.
Right? So, yeah, and that was going to be my next question, because obviously the patients benefit, which is amazing, because they don't have to go into a hospital setting. You basically bring service to them. But I can imagine the physicians themselves also.
Right.
The caregivers are benefiting from this.
Absolutely.
You're helping them as well.
Absolutely, because right now, radioligand therapy is not given in every facility. You have to have a specific license. You have to have a physician that has this very specific training. You have to have nuclear technologists with a very specific skill set. So not every institution is going to have that, and not every institution is going to be able to be licensed or have the financial wherewithal to provide the service. Because if you do the numbers, for each patient, you have to be able to come up with about $300,000 that you guarantee to pay the manufacturer of this drug for the entire treatment cost. How many practices can physically do that?
Sure. Now, is there a savings anywhere for health insurance companies, or
Tremendous.
I mean, how do you get them on board? Because that's where I'm.
So I'm actually in negotiations with a very large health insurance company right now. That's a national health insurance company, and if everything goes well, we're going to start a pilot project in Florida. I'm not going to I cannot mention the name of this insurance company yet. Yeah. But that being said, our pitch to this particular institution was the fact that we're going to be able to decrease the cost of care for the lifetime of this patient. So if you follow the patient from the time of diagnosis to the time of, and I hate to say it this way, end of life, right. And you calculate the entire cost of that patient's life cycle for this specific disease, our pitch was, if by utilizing us, we're going to, in the very base case, in the very extremely conservative base case, by utilizing radioligand therapy early in diagnosis, we're going to be able to save at least 25% of the total lifetime cost to this patient. Okay. And in a very optimistic scenario, we're going to save 44.6% according to our calculations. Wow. By utilizing radioligand therapy very early in the diagnosis process rather than the later parts of diagnosis. Because when you look at what an insurance company pays for, what a facility pays for the patient, is not just the cost of the chemotherapy or the radiation therapy or the drugs that we use to treat the patient, but it's in the cost of maintaining the quality of life. With chemotherapy and radiation therapy, we're bombarding them with chemicals and radiation that wipes out their immune system. Right. So they're going to have secondary infections. So we're going to need to spend money on mitigating those infections. Radiation causes radiation burns. Now we have to treat radiation burn. We got to treat the muscle wasting. We have to treat the hair loss. We have to treat the fatigue, the mental load that's taken. That's the burden on all these patients. There's money to be spent on that. So and also long-term care. A lot of patients end up with progressive cancer that they can no longer take care of themselves. So you need nursing care. You need skilled nursing facilities sometimes, and hospice care. So if we're able to treat them earlier, give them the quality of life back, and also we can never say we're curing the disease. That's something that those words we can never say. But can we say that we're going to regress the cancer down to levels that's manageable? Absolutely.
Yeah, and that's a huge start.
And that's how we're going to save money to insurance companies and to the Medicare and Medicaid system. And one of my biggest pushes is I have to be around for about a year before I can do this, but I want to get into the VA system. I want to be able to provide the service to our veterans. Yeah. And by doing that, we're going to be able to save the federal government a ton of money that they're probably spending out right now. But in order to be a part of the whole procurement process to the VA, I have to be around at least a year and prove myself.
Yeah, I mean, we should be able to provide it to everyone who needs it. Right. Now, the other thing you got me thinking about. So we're saving money for the insurance companies. We could save the federal government money. quality of life is better for the patients. I mean, to me, it's like a win-win-win all the way around.
Absolutely.
Now, what particular cancers are we talking about here? Because it can't be every form of cancer, right?
Not yet.
So we're talking prostate?
We're starting with prostate.
You're
Right now,
starting with prostate.
radioligand therapy can be used in multiple different types of cancers.
Okay.
But we chose to start with prostate cancer. Are we licensed to treat different types of cancers? Yes. And state of Texas gave us an open license to treat all forms of cancer that can be treated by radioligand therapy. So there's things like carcinoid tumors, small cell carcinoma, a certain type of neuroendocrine tumors. Coming down the pike in a couple of years, we're going to be able to treat breast cancer,
Okay.
thyroid cancer.
So really, it's wide open. It can go
Right,
to
because the
everything.
way this medicine works,
Okay.
we're using a radioactive material, a nuclear isotope that's tagged to a protein called a ligand, and this ligand acts like a smart bomb,
Okay. So it's very targeted.
molecularly targeted therapy.
Okay.
So this ligand now goes throughout the body, seeks and locks on
Okay.
to receptors that's the cancer cells are expressing. No matter where it is in the body, it goes, locks in, and then it completely bound to this receptor.
Okay.
And once, as it's bound, the energy that's being emanated from the radioactive material is now going to be focused in that local area, where this smart bomb is now imparting all of its energy in a couple of millimeters of
Right.
where it's locked in.
Instead of destroying all the good cells. with-
Exactly.
Yeah, like what chemotherapy does.
And radiation therapy does.
Yeah, because I gotta tell you, even from my own wife's experience, I mean, they gave her so much chemotherapy that she ended up with with poison,
Right.
which created a whole bunch of other problems
Right.
for her. And destroys, like you said, just like a wildfire, destroys all the good cells.
Destroys
Which I
everything.
never I mean, it's such an archaic way of treating someone. I never understood that. I mean, I get it in the beginning when we had nothing better, and that's all we had. With today's technology, I mean, I love this. This is exactly where, definitely the trajectory we should be going.
Exactly,
Really-
and that is the trend of medicine, molecular genetic medicine. And we're getting better at getting these targeted treatments out, and the more use cases that we're going to be approved for as FDA starts approving new things. There's so many studies out there right now in many different aspects of cancer, oncology. We're going to be able to add that onto our services.
Sure.
But we're starting specifically with prostate cancer because men are underloved.
Yeah.
Well, not to say that we shouldn't be treating women as well. Of course we have, but women have the breast cancer month, and they got this. And
Right, there's
they
more of
have
a focus on women
There's a
issues.
tremendous focus on women, but men don't.
I think part of it is our own fault.
It is our fault.
You know,
We have
don't go to the doctors as much as women
we have too much
do.
pride.
Yeah.
What are the major impetuses for men to get treated is we have too much responsibility. We tell ourselves this.
Yeah, we gotta work.
We have to work.
Yeah.
I can't take my time. I can't take time out for this. I can't take time out for that. If it's my time, I'm gonna go. Don't worry about it.
Yeah.
And that's what we tell ourselves.
It's such an old school way of seeing it.
Exactly. And we brought this on to ourselves. So I just kind of figured, like, listen, if we focus purely on prostate cancer and we bring this out to the communities where we tell men that, hey, listen, you don't have to take time out of your life. You don't have to take time out of your responsibilities. We're going to come to you. We're going to be at your local clinic. We'll take care of everything. You just come right here. You don't have to travel hours. You don't have to sit in traffic. You just come to your local center,
Yeah.
and our bus will come there and take care of you there.
That's a game changer. So where do you see this in 5-10 years? What you're doing?
Well, if the NFL is helping us out the way they are, like with the commercial that Novartis had on Super Bowl, it's just a blood test. The more that people are getting diagnosed, the earlier they're getting diagnosed, the more awareness goes out there, and if our team does the job that we're supposed to do, and we get out there and do our health events. We're going to be doing a lot of community health events where we're going to do vitals, free prostate specific antigen blood draws. That way we can diagnose people earlier in the disease process, especially our Hispanic and African American Black communities. They are diagnosed very late. Yeah. Because of low access. They don't have, especially down south, you'll see medical deserts, and these communities have no access. Yeah. The Native American community, the more people that we can reach that would normally be diagnosed later when they come in with saying, oh, my back is hurting, my neck is hurting, my shoulders are I'm taking all this Advil.
Especially in really rural areas.
Right, and it doesn't have to be rural. You can have these medical deserts in the middle of a big city because they just can't get access. They don't have the right insurance. They don't have the right doctor, or the doctor's not looking. Especially with prostate cancer, metastatic prostate cancer that's diagnosed in their 60s, especially in certain demographic groups, they come in with back pain.
Okay, that's kind of one of the symptoms.
Oh yeah, you strained your back. Here, take this pill. No, doc, it's not going away.
But it comes up. I mean, it comes up on a blood test, right? No, PSA at least.
You get if your PSA is high.
Right, so that gives you. Something's going on.
And then what do most men say when they say, here, my PSA is high? Oh man, I'm going to get that finger up something.
Yeah, I know.
How many men want that finger?
I get it. I get it once a year, unfortunately. Trey over here doesn't want it. Trey saying no, not me. So, you know what my doctor says? He goes, he'll ask me like, hey, so do you want me to check? He goes, hey, it's already included in the price. I'm like, well, I guess so. You may as well go for it.
Oh man, how thick is that finger?
I make sure he's a real short guy. He's a tiny guy, small hands. I'm no fool.
I don't know. They have some stubby fingers.
I don't go for like a big 6 foot guy, really meaty. No.
Oh man.